Just a few weeks after giving birth to our first child, my husband and I learned that our daughter had cystic fibrosis. CF is a genetic disease that mainly affects the respiratory and digestive systems. CF occurs when the genes in the body that produce a protein called the CFTR protein are mutated. So the CFTR protein is what the body uses to control the flow of salt and water in and out of the cells. So organs like the lungs and the pancreas are affected in that a sticky mucus builds up and creates a lining, which does two things. Number one, it inhibits the natural functions of the organs. And number two, it creates this ideal environment for infections to occur. When someone is diagnosed with cystic fibrosis, they begin a routine checkup plan and treatment plan. CF patients are seen by a team of medical professionals, typically a pulmonologist, a gastroenterologist, a dietitian, nurses, a psychologist, a social worker, a respiratory therapist, and sometimes an ear, nose, and throat doctor. These visits are made at least every 3 months and are done more frequently as complications arise. In addition, patients are required to have blood work and chest x-rays done at least once per year. Many CF patients also have a routine hospitalization once per year. This is commonly referred to as the clean-out, where they're hospitalized for about a week and are given a rigorous schedule of treatments to try and clear their lungs of dangerous mucus and bacteria. On a daily basis, CF patients have quite a few treatments and medications that are required to keep them healthy. Here's a quick rundown of what my 4-year-old daughter Ava's current treatment schedule is like. She wakes up and begins her day with 1.5 hours of airway clearance treatments. So this is her nebulizer machine. She nebulizes 4 different medications right now. Holds her mask on like this, and one of the medications helps to open her airways, another helps to kind of relax the muscles, another kind of chops up the mucus, any mucus buildup that's in her lungs, and then a 4th is an antibiotic that's used to fight an ongoing infection that she has had for over a year now. In addition to her nebulizer, she does a vest treatment. So I won't put this on since it's much too small for me, but she puts this vest on her. And this big heavy machine here pumps air and pulses through the vest, and it quickly shakes her chest, which loosens any mucus buildup and makes it easier for her to expel that mucus. After that 1.5 hour session is complete, she is off the hook until the evening, and then she starts it all over again and does it before bedtime. After her breathing treatments, she will be given a liquid medication through her feeding tube. So her feeding tube looks similar to this. It's surgically inserted in her stomach, and right here is where we would hook in the actual feeding tube itself. This is referred to as a button. So this is in her stomach, and we hook it in, and this is where she'll get medications. She likes that she doesn't have to take them in her mouth anymore. And then she gets to have food given to her through the night. So I'll make a shake for her with all the 4 basic, all the basic food groups, and then pump it in throughout the night to help her maintain and gain weight. So this is just a small glimpse into what a typical day is like for a child with CF. While all CF patients do breathing therapy, their other treatments can vary widely. At one point, Ava was taking up to 14 medications per day. Many CF patients are unable to digest their food because their pancreas is lined with mucus and cannot release the needed enzymes. Because of this, they'll take a number of enzyme pills prior to eating everything, except for maybe fruit. Also, when cystic fibrosis progresses, it brings with it new challenges. When a lung infection cannot be effectively treated at home, they are admitted to the hospital for IV antibiotics. Many patients have a somewhat permanent IV port placed in their body to make these treatments easier. Cystic fibrosis adds a lot of stress on both the patients as well as the family. Patients with CF are unable to associate with one another due to the fact that they can easily pass lung infections back and forth to each other. So there's somewhat of an isolated feeling there. In addition, CF patients need to be extremely careful when it comes to common respiratory illnesses like the cold and flu. While others may not have issues with these, a CF patient could end up hospitalized with complications. As such, kids with CF often have to miss out on birthday parties, play dates, and even primary classes when someone else comes with a cold. Because of this extra measure of caution, coupled with frequent hospitalizations and doctor visits, many CF children become aware of their differences at an early age. Some even realize, without their parents ever mentioning it, that they may have a life that's cut short. Ava, at 3 years old, began to wonder about her death. She frequently asked if she would soon die and has even spent some nights in tears worrying about her health. We've cautioned her to not be around people who smoke, and while we try not to scare her, she's nearly fanatical about it now and sometimes bursts into tears if she accidentally smells smoke. Ava feels that she's different in major ways from other children, and this is exacerbated when she sees her siblings playing while she is made to do her treatments. This adds stress for the whole family, but especially mom and dad, as they try to decide on whether to spend time with her or to spend time with the other children. My husband and I feel equally guilty if we leave Ava alone to do her treatments or if we leave the other children to fend for themselves while we sit with Ava for her treatments. Ideally, we would both be home and be able to split the time, but that doesn't always happen. Speaking of siblings, each additional child has a 25% chance of having cystic fibrosis, so this is added stress on the parents when they're trying to decide whether or not they want to have more children. Also, Ava was hospitalized 3 times at the age of 3, and it was heart-wrenching to watch her cry for us to take her home. She would burst into tears and say, "Mommy, Daddy, please put me in my car seat and take me home." But we knew we couldn't do it. And as young children, they don't understand that. They don't understand the complexities of their bodies, and they don't understand why the doctors and nurses who are hurting them are actually helping them. So this is another stressor that's added to both the patient and the parents. Cystic fibrosis is a chronic disease, and while a child with CF may look healthy, albeit skinny, on the outside, their body is progressively deteriorating on the inside. They have much more to deal with than most kids their age, and as such, their outlook on life is usually a bit different. This is what life is like every day with cystic fibrosis.